So okay, so I'm going to begin my skills. I would first begin by reviewing the patient's chart, making sure to see if there's any physical limitations, and confirm the medical orders. I would then gather all my necessary equipment and get help from another staff member. I would perform hand hygiene and put on appropriate PPE, identify the patient. So I'd go ahead and say, "Hello, ma'am. My name is Emilat Garza. I'm your student nurse for the day. Is there anything? Can I please have your full name and date of birth, please?" I would then ensure privacy to the patient, so having closing the curtains or the door, depending on the facility. And then I'd go ahead and discuss the procedure with the patient and ask the patient if they are allergic to any medications, latex, iodine. Um, I then go ahead and discuss the procedure with the patient, ask them if they have any questions, and then I'd go ahead and have ensure that I have good lighting. If I need it, I'd go ahead and use a flashlight, being held by like an assistant, and bring a trash can near me, so I have it within reach. I would assemble all my equipment, put it on the overhead table, and adjust the bed to a comfortable working height. So usually around elbow height. I'm then going to stand on the patient's right side. Since I am right-handed, if I was left-handed, I'd go ahead and stand on the patient's left side. And I'm going to help the patient into a dorsal recumbent position, having her knees flexed and around 2 feet apart. And I'm going to drape the patient to ensure that I only expose the needed area. And I would have the patient slide all the way down to where the buttocks is near the edge of the bed, and have her pull her knees down towards her like chest. I would then put a waterproof pad under her. I would ask her to lift her buttocks up and put a waterproof pad under in between her and the bed. I would begin with clean technique, so I'd go ahead and put some clean gloves, and with a washcloth and a soap and clean cloth, I would go ahead and clean the perineal area. I would make sure to use like a different corner of the washcloth with every stroke. Never reuse the same part of the washcloth twice. I would make sure to wipe from front to back towards the sacrum. And then I would rinse and dry the patient's perineal area and remove gloves and perform hand hygiene. Using a sterile technique, I'd go ahead and open the sterile catheterization tray, and bring if the overhead table wasn't near me, I'd go ahead and put it all on the overhead table. I would then put on the sterile gloves and then grab the drape. I would make sure to grab it from the middle, making sure not to touch the outside edge that is unsterile. And I would place it. I would place the sterile drape under the patient by having her lift her thighs, her buttocks area, so I can put it under. And I would place the sterile the sterile um, uh, okay. I would place a sterile drape over the perineal area, and making sure to expose the labia, and all based on the facility's policies. I would place the sterile tray or in between the patient's thighs, and I would open all my necessary supplies, such as like the antiseptic swabs or cotton balls, depending on which I have. If they're cotton balls, I'd go ahead and pour them into the antiseptic solution. And if specimen were needed, I'd go ahead and open the container and have it ready. I would insert the syringe with 10 mLs of normal saline, making sure that at this point I'd go ahead and have my dominant hand be considered sterile and my non-dominant hand be considered non-sterile. So I'd insert the syringe 10 mLs with normal saline into the catheter port with my dominant hand, which is my right hand, and I'd go ahead and lubricate 1 or 2 inches of the catheter's tip. At this point, with only my dominant hand being considered sterile, I would spread the labia with my non-dominant hand using my thumb and a finger to identify the meatus. So I'd go ahead and open the labia, and I would maintain the labia separated with my non-dominant hand until the urine is comes out continuously. With my dominant hand, I would then grab the sterile forceps. Since in this case I would be using the cotton swabs, I'd go ahead and with the sterile forceps grab them, and holding the labia open, I would go ahead and clean from one side of the labia fold from top to bottom, and then discard that, and then get a new cotton swab, and then clean the other side from top to bottom again. With my dominant hand, I would place the drainage end of the catheter in the receptacle, and if the catheter is a pre-attached sterile tubing and drainage catheter, I would set up for easy reach on the sterile field. I would make sure that the clamp of the drainage is remained closed, and then I would go ahead and hold the catheter 2 to 3 inches from the tip of the insertion, and slowly, from the tip. So I'd go ahead, hold it from 2 to 3 inches, and then I'd slowly insert it into the urethra. I will continuously advance the catheter until the urine comes out. Once the urine drains, I would advance the catheter another 2 to 3 inches to making sure not to force the catheter through the urethra, so I won't hurt the patient. If there's any resistance to the catheterization, I'd go ahead and ask the patient to relax and breathe deeply. I would then hold the catheter securely at the meatus with my left hand, and which is my non-dominant hand. I would then ensure that with my right hand, which is my dominant hand, I'd inflate the catheter with the balloon by injecting the pre-filled syringe. I would gently pull the catheter to make sure I feel like resistance that it is in place, making sure not to pull too hard. I would remove all the necessary equipment and ensure that they're disposed in the appropriate container. If there's any sharps, dispose of them in the sharp container. I would then wash and clean the perineal area as indicated, and I will make sure to secure the catheter tubing to the patient's inner thigh with either Velcro straps or tape, depending on what we have available, and making sure I don't pull too tightly to where it is very restricted movement. I would then secure the bag below the level of the bladder, so I'd go ahead and hang the bag on the area of the bed that does not move, and I would then ensure to check for any kinked areas of the tubing, and if urine specimen would be needed, I'd go ahead and put on clean gloves if I have taken them off, and obtain the specimen immediately, if needed, directly from the patient or from the bag, and refrigerate it as needed, or take it to the laboratory as soon as possible. Again, I would then finally remove gloves and perform hand hygiene. So that is part for the first part. I would now go ahead and begin with the removal of the indwelling catheter. So I would begin by confirming the medical orders again, making sure that there is a medical order for the removal, and gathering all my necessary supplies. I would perform hand hygiene and put on the appropriate PPE. I would go ahead and identify the patient. So I'd go again and say, "Hello, ma'am. My name is Emilia Garza. I'm your student nurse for the day. I will be discussing the procedure that we will be removing the indwelling catheter." I would ensure privacy by closing the curtain or the door, making sure whichever the two is available in the facility. And again, I would adjust the bed to a comfortable working height, which is around elbow height. And like in the other part, I would go ahead and stand on the right side of the patient, since I am right-handed. And I would position the patient like if it was a catheter insertion, and drape the patient and put on a waterproof pad beneath the patient. If she's a female. If the patient is a male, I'd go ahead and put the waterproof pad on the thighs of the patient. I would go ahead and remove the taping, making sure that everything is removed gently. If there's any swabs needed, I would then any swabs needed to remove the adhesive tape if it was used. I would then insert the syringe into the balloon inflated area and or the port. Usually it comes out with gravity, but if there's any resistance, I'd go ahead and aspirate as needed. I'd make sure not to pull or yank the balloon out, because I can seriously damage the patient or hurt the patient. I'd also make sure not to inflate, not to cut the inflated portion of the balloon. I then go ahead and ask the patient to relax and take slow, deep breaths. And while they're doing that, I'd go ahead and slowly and gently remove the catheter. And place it right beneath them in the waterproof pad and wrap it up. I would then go ahead and again wash and dry the perineal area, and as needed, ask the patient if they need any help or any other assistance, and I'd go ahead and put them into a comfortable position. I would cover the patient and place them in the lowest position possible, and I would remove all my necessary equipment, remove all the equipment and dispose of it as appropriate, making sure to note the characteristics and the amount of urine in the bag. And I would finally, once I'm done with everything, I would remove my gloves and remove my PPE and perform hand hygiene, and make sure to have the call bell near the patient, and for them to be in the lowest position, and let them know if they need anything to go ahead and just call. Okay, thank you.